Alright, let's dive into something that's been buzzing in the medical world lately: stem cell injections for knee osteoarthritis, or KOA. Now, before we get into the nitty-gritty, let me hit you with a quick stat. Over 1 in 10 people over 40 deal with KOA. That's a lot of folks struggling with pain and mobility issues. And here's the kicker: treatment options are pretty limited. So, when stem cell injections came onto the scene, they felt like a game changer. But here's where it gets interesting: the results. All over the place. Some people swear by it, while others see no change. What's going on here? That's the million-dollar question. Personally, I think the variability in outcomes is what makes this topic so fascinating. It's not just about whether stem cells work, it's about why they work for some and not for others. And this is where the science gets really intriguing. The cells used in these injections, called mesenchymal stromal cells, MSCs, are often taken from the patient's own body, like fat or bone marrow. Sounds great, right? No risk of rejection or infection. But here's the catch: not all MSCs are created equal. The quality and potency of these cells can vary wildly from person to person. What many people don't realize is that this variability isn't just a minor detail, it's the heart of the problem. If you take a step back and think about it, predicting which MSCs will actually work could revolutionize this treatment. And that's exactly what a team, led by Soumya Viswanathan, from the Schroeder Arthritis Institute tried to tackle. They followed up on a clinical trial where KOA patients received Master of Science injections from their own bone marrow. The results? After 24 months, about half the patients reported significant improvements in pain and mobility. The other half? Not so much. Now, here's where it gets really interesting. Viswanathan's team didn't just stop at the results, they dug deeper. They ran lab tests on the MSCs from all 12 patients and found some striking differences. The MSCs from patients who responded well had a stronger anti-inflammatory effect and better immune dampening abilities. But what really caught my eye were the 14 microRNAs they identified. These tiny molecules were present in different quantities in responders versus non-responders. This raises a deeper question: could these microRNAs be the key to predicting which MSCs will actually work? From my perspective, this study is a huge step forward. It's not just about treating KOA, it's about personalizing the treatment. Imagine being able to test MSCs in a lab, and only using the ones with the highest therapeutic potential. That could mean more consistent results and fewer patients left wondering why it didn't work for them. But here's the thing: this is just the beginning. Larger studies are needed to confirm these findings, and that's where the real challenge lies. One thing that immediately stands out is how this research connects to a bigger trend in medicine: the shift toward precision therapies. We are moving away from one-size-fits-all treatments and toward solutions tailored to the individual. And if this works for KOA, who knows where else it could apply? So, what's the takeaway here? In my opinion, this study is a reminder that even the most promising treatments aren't magic bullets. There's always more to uncover, more to understand. And while stem cell injections for KOA aren't a sure thing yet, they are definitely worth keeping an eye on. What do you think? Is personalized medicine the future, or are we getting ahead of ourselves? Let me know in the comments. I'd love to hear your thoughts.